Really quick talk on Enuresis, which is nighttime bedwetting. And it's a disease when, or pretty much a pathology when you have bedwetting two times a week at least for 3 or more months. And the patient, the baby, or the kid, sorry, has to be at least 5 years or older. Because before that, if you have a 3-year-old that's just peeing in the diaper, is that Enuresis? Obviously not. It's just normal, okay? This is abnormal once they get to a certain age and it's not developmentally normal for this to happen. Again, 2 times per week for 3 or more months of nighttime bedwetting. And this can be quite distressing for kids. You don't have to know this for step one, but I just want you to understand, like, these kids, if they're wetting their beds at night, they can't go have sleepovers with their friends. It's embarrassing. It's just not great. Okay, some kids don't care, but some kids are quite distressed by it. Their parents are quite distressed by it. And the way you treat this is, well, number one, education. Teach them to not pee in their bed, and encouragement. So you can give them something like a star chart. Okay, a lot of this is based on psychiatry and conditioning. You give them stars, you reward them for not peeing in their bed, and when they pee in their bed, they don't get a star. So then you're training them to not wet their bed through psychiatric techniques. And then the other thing you can do is you make them void regularly during the day and just before bed. So that, again, that's just training them to pee more, to empty their bladder nicely, and then before bed you empty it so that so they don't have to pee when they're in bed. Now, if the above fails, you can try Bedwetting Alarm or desmopressin. So desmopressin is an ADH analog. So if you're giving ADH, what happens? You get more water reabsorption, so less water in the urine. So they have lower urine volumes, less likely to pee. Bedwetting Alarm. Basically, it's a fancy little alarm that detects when you wet your bed, and it's going to wake you up. And again, it's more psychiatric conditioning. Okay, this is super low yield for step one, but it kind of reinforces the conditioning stuff. It actually acts through both classical and operant conditioning. Okay, operant was like the positive punishment, and that was when if they wet their bed, they get woken up. That's the punishment. You wake them up. Classical conditioning is really complicated, but I'm not even going to get into the details of this, but basically they start developing a response of waking up and going to the bathroom in response to the stimulus of a full bladder. So you basically, it's like this is the dog salivation one, okay? But instead of salivation with seeing food, basically food is the full bladder, and then the response is waking up and going to the bathroom, and instead of salivation. So that is your enuresis.